Canada has a severe shortage of family doctors, with over 6 million adults in Canada saying they don't have regular access to a family doctor or nurse practitioner. That translates into over 1 in 5 adults without regular access to primary care. And the Ontario Medical Association warns it's only going to get worse.
The really scary part for me is that, that we're moving towards, 2026, the prediction is 1 in 4. So 25% of people in Ontario without a family doctor. So it's getting worse. There's a lot of harm. Like there's a lot of morbidity, mortality happening because of this.
For more on what this means nationally, Dr. Kathleen Ross is the president of the Canadian Medical Association, and she joins me now. Welcome back to the program, Dr. Ross.
Pleasure to be here. Thank you.
So the latest data suggests about 6.5 million Canadians are without regular access to primary care. What impact is this having on the health of our population?
There's no question at all this is going to be having an impact. Family physicians provide that comprehensive care, cradle to cradle, or what I like to call diaper to diaper, and really ensuring that patients have that continuity of care to help navigate our complex health system. And really, without that family physician, you're walking through your health and wellness journey unsupported. This is a growing crisis. It takes a toll on patients that don't have access, and it certainly takes a toll on those of us trying to provide optimal care in an under-resourced system.
I was speaking to a 30-year-old woman yesterday. It took her 7 months to get diagnosed with colon cancer because she didn't have access to a family doctor. She says if she had that physician to go to, she might have had this recognized earlier. She might have been able to have treatment earlier. It just seems unconscionable, doesn't it, that someone has to wait 7 months just to get the diagnosis that they have colon cancer.
And we know that there are potential solutions out there. And this year we've seen historic investment on behalf of the federal government in healthcare, and we're seeing that transparency and accountability across jurisdictions agreeing to invest in primary care. We know we have to get moving on improving how we're delivering care now, but simultaneously planning for the future. And that begins by having a hard look at what we've got for a workforce today and determining what we're going to need in the next 10 to 20 years.
Let's talk about the future, and I want to talk about retirements in particular. I was struck by one figure that was relayed to me recently. About 2 million people in Ontario have a doctor that's over the age of 65. There are similar figures in other provinces. There really could be a tidal wave of departures in the next few years, couldn't there? Are we ready for that as a country?
Well, I think the other interesting statistic is that the average age of family physicians in this country is over 50. So not just the immediate retirements, but again, looking that 10 to 15 years out in the road. Looking at these solutions, we need to increase our training opportunities. So we've heard a call for increase in residency positions across the country, but we have to look at working to improve the situation for the workers we already have. And that means improving physician mobility so that we have the ability to take time away for personal training, additional education, holiday. I think these are all challenges we face. The time is definitely now for us to look at fully supporting team-based care across the country so that we have the ability to leverage the skill set of other healthcare workers. We need to decrease the administrative burden that we face as family physicians and really streamline our time so that we're not spending 18 and a half million hours a year on unnecessary paperwork.
The federal government has cut some funding deals with the provinces. There's been 7 signed so far at last count. There is some money allocated in those deals for medical residency spots to boost enrollment so we can graduate more doctors. There's foreign credential recognition funding as well. Do you think Ottawa has done enough to address this family doctor crisis?
I think this is a crisis that crosses jurisdictions and it crosses political parties. We know we can't recruit our way out of this, but certainly having those internationally trained physicians and nurses that are in Canada who want to work here and streamlining their incorporation is great. We need to train more, and that's something that requires collaboration across all jurisdictions. We also know that we need to work on retaining the physicians and nurses that we have in play now by improving their work environment. All of those have to happen, and there's no one jurisdiction that can solve this. We need this ongoing documented collaboration. And quite frankly, that's where I see the hope for our Canadian healthcare system right now is in this collaboration. And I need to keep encouraging Canadians to ask those tough questions of their political leaders. Keep health and wellness top of mind, and I believe we will see significant improvement in the months to years ahead.
Yeah, there has been some collaboration. Ontario and the federal government did sign a healthcare deal a few weeks back, but I was kind of digging into the numbers in terms of what they agreed to. They've essentially agreed to fund 269 more medical residency spots for family medicine in Ontario. And if every doctor treats about 1,000 patients, that means give or take 269,000 people could gain access to primary care as a result of this deal. But right now, 2.2 million people in the province don't have access to a family doctor. It just seems like this big deal that's been touted as a multi-billion-dollar fix is really just a bit of a band-aid for the problem, isn't it?
You know, JP, I think this highlights the need for us to really start leveraging all healthcare workers' potential as part of a team. And having that team includes a physiotherapist, a pharmacist, a nurse or nurse practitioner, social worker, so that we can work to meet the needs of Canadians in the immediate time while we work to train for the future. But these all three aspects are needed. We need to increase what we're training at home. We need to ensure that we can recruit and retain the workers that we have. These are long time coming problems, and I think there are steps we can take immediately to make improvements.
Ottawa is also about to announce a multi-billion-dollar pharmacare deal in the coming weeks. I've heard from some doctors and some patients who say that money should really go to fixing the system we already have. What's your take on this?
So there's no question at all that I see in my own practice throughout the years challenges where patients are making a decision between taking their medication, paying their rent, or getting food for their family. So we have to find a way that we can improve access to necessary medications. It's a tremendous investment upstream for prevention if we're able to provide necessary treatments for patients before they develop complications from chronic diseases. So, yes, we're in support of having these conversations.
Would you support, though, moving ahead with a pharmacare program that's national and universal that could have a massive billion-dollar, multi-billion-dollar price tag attached to it?
I haven't seen the specifics of the proposed plan. However, I think we need to look at all aspects of health and wellness, and a part of that is actually is medications.
You talked about retaining doctors, uh, and it's almost as if the word has gotten out to some people who are in medical school that family medicine is a tough job and it might not be as good as it used to be in terms of work-life balance, maintaining some semblance of a division between those two. And the numbers at medical schools really reveal that the number of people entering family medicine has dropped considerably over the last 10 years. The latest medical school data shows only about 30% of residents are picking that field to enter now. What can we do to just make this profession more attractive so we can have some more family doctors in the system?
So I really do think we need to work on our model of care and moving to that team-based system where we can collaborate and ensure that patients get the care that they need in a timely way will go a long way to improving the retention of workers in family medicine. We need to do a better job of really highlighting the value of this incredible profession. Family medicine, and I've been a family physician for 30 years now, I can say with confidence, is a tough job, and it has become more tough in recent years with aging population, increasing complexity of illness, mental health, and addiction challenges. There's no question that there are unmet needs. If we can shore up our system of care so that we are fully able to support healthcare providers, work in teams, and address some of these gaps, family medicine will be an attractive profession in the future. It is imperative that we make the workplace sustainable for those of us delivering primary care.
What's the risk if we don't do something to turn this around?
I think the health of Canadians really rests on the health of our primary care system. This has been called a gatekeeper, but by your article just recently. But truly, this is the foundation of our healthcare system, and majority of care to Canadians is delivered in that primary care over a lifetime of care together. And we know that that's better outcomes, lesser costs, and fewer investigations. So we do need to ensure that Canadians have access to that foundational level of care.
All right, let's leave it there. Thank you so much to Dr. Kathleen Ross, the president of the Canadian Medical Association.